Hey guys, Dr. Stephanie here, and I'm sure a lot of you have heard of frozen shoulder, or maybe you even have frozen shoulder. Frozen shoulder is a condition where you usually have pain and definitely stiffness in your shoulder. So you may have difficulty reaching up overhead. Maybe you can't even reach overhead. You can only reach to about here. Maybe you have trouble reaching behind your back or over your head, or even picking up something heavy or even something light, or you just have a lot of pain in your shoulder and you just really feel that stiffness. This can happen to anyone. It's more common in women, but can happen in men too. It's also more common in women about middle age, so anywhere from like 35 to 40 and up to 50 to 60. That's the most common age, but it can occur in anyone. And sometimes it just happens seemingly for no reason. You don't have an injury or any kind of fall or accident or anything. You just kind of gradually feel that stiffness getting worse, feel that pain getting worse. Sometimes you do have an injury. Maybe you fell on your shoulder, maybe you had surgery, and then you all of a sudden can't lift overhead, or you can't reach behind your back, or you just have and pain and stiffness together. So this can happen for multiple reasons. Sometimes there is no specific cause, but there's three different stages of frozen shoulder. The first is the freezing stage, and so that's usually a pretty painful stage, and that's when the shoulder basically starts freezing. So what happens is basically there's a shoulder capsule, and it's a bunch of tissue that kind of surrounds the joint, and those tissues get thicker and tighter, and so it keeps your shoulder from moving, and lack of motion actually makes it worse. So if you start having pain and stiffness, a lot of times people feel like they don't want to move. And when you don't move, it actually can get worse. So that tissue can get thicker and tighter. And so that's kind of the freezing stage as that's happening. And then there's the frozen stage where it's not as painful, but you just can't move. You can't reach your arm overhead. You can't reach your arm behind your back. And then finally, after that, there's the thawing stage. And that's when it starts getting better. You start getting more motion and less pain. This process can take a long time. It can take a year to even 2 or 3 years. It doesn't necessarily have to take that long, but just be patient if you think you've had this a long time and it doesn't seem to be going away. But there are exercises that can help. Physical therapy can definitely help. So I'm going to go through some exercises that will help reduce your pain and improve your mobility to kind of speed the healing process. So we're going to start with this golf club. Now, if you don't have a golf club, that's okay. Just some kind of stick, maybe a broom, or um, a broom or a cane, or whatever you have that's kind of stick shaped like this. You're gonna lie down. You can lie on the floor or you can lie on your bed, but you want to hold this golf club in both hands, about kind of shoulder width apart. And what you want to do is lift, and you want to lift as high as you can lift. So let's say that my right shoulder is the frozen one. So you want to guide the right arm with the left arm. So you want to pull back as far as you can go. Now I can go all the way to the ground, and if you can too, that's great. This is still a good stretch. But if you can only go to here, you kind of want to use the non-frozen shoulder to kind of pull back a little bit until you feel a stretch in the opposite shoulder. You just want to hold that for a second or two and then come back down. And it's okay to have some pain. There's definitely some pain in the process of healing frozen shoulder. You don't want it to be too high though. So if you're rating it on a scale of 0 to 10, keep your pain level no higher than about 4 to 5 out of 10. If it goes higher, then you actually can just kind of irritate that area because you're causing too much pain. So a little bit of pain is okay as you're stretching, but you don't want too much pain. So you want to do about 20 to 30 of those. It takes a lot of repetitions to actually result in tissue change, to really change that range of motion. So 20 or 30, and you may even want to do this multiple times a day. And I would do it every day, especially if you're really having a lot of stiffness in that shoulder. Okay, then I'm going to show you 2 ways to do the next exercise. For this next one, we're going to use the golf club again. I do want you to put something underneath your arm. So just kind of roll up a towel here, hold on to the end of the golf club or the cane or the broom, and you're just going to push. You're going to keep this shoulder up at 90 degrees. Keep your elbow bent to 90 degrees and just kind of push backwards like this. Just push backwards as far as you can. Pause for a second or two, and then come back up. So push back and come back up. Again, 20 or 30 repetitions. You can do more than that. It takes a lot of repetitions to really result in that tissue change and improving that range of motion. So try to do that every day, and you can do as many as you're comfortable doing. Again, you don't want to have too much pain. So if it's causing a ton of pain, you can definitely back off a little bit. Okay, so to make that one a little more challenging, now you're going to grab a small dumbbell, keep your arm on this towel, and you're just going to use the weight to kind of weigh your hand down towards the floor and then come back up. So if you can only go halfway, just kind of let it weigh your hand down, pause for a second or two, and then come back up. But the goal is to get all the way down to the floor there, or the bed if you're on a bed. So you just want to slowly let that weight pull your hand down and then come back up. Slowly let it pull your hand down and come back up. Okay, so for the next exercise, we're actually going to lie on our stomach and use this towel again. And so you're going to prop your elbow on the towel, again, shoulder bent to 90 degrees, elbow bent to 90 degrees. And from here, we're going to lift our hand up off the ground and then back down. Lift your hand and back down. And it's easy to kind of just lift your hand, your wrist like this, but you want to keep your hand in line with your forearm. So you're kind of lifting your whole forearm here and then back down. So lift up as high as you can. If you can't quite lift up yet, that's okay. Just try to do as much as you can, or even if it's just kind of like a very slight off the floor, that's okay too. Sometimes even just if you're really stiff, if that shoulder feels really stiff, just lying in this position can actually work on stretching that as well. And then you can work into lifting your forearm up off the ground. Okay, so then from there, we're going to come up into a hands and knees position. And from here, what I want you to do is we're going to do a row. So you're going to pull that elbow up like that, and then rotate your hand up towards the ceiling, and then back down. So row, rotate up, and back down. Row, rotate up, and back down. And if you can't go up that high, that's okay. Just go within your range of motion, within your pain tolerance. But the goal eventually is to rotate up like this, so 90 degrees of rotation. Then you want to do 20 or 30 of these. You can do this on both sides, but this is most important on the affected side. Okay, then from here, we're going to start in this position, and we're going to do a child's pose. And I know a child's pose is usually for back pain, but it does actually work on stretching your shoulders. So you're going to start here, and you're going to kind of sit back on your heels as far as you can. Now, if your shoulder is really stiff, you may not be able to go back as far. That's okay. You just want to go back as far as you can and try to hold that for 5 or 10 seconds. And then come back up. So sit back on your heels, hold for 5 or 10 seconds, and then come back up. And just do that within your range of motion. When you feel a good stretch here, that's when you should stop. And the more you do this, the further you should be able to go back. Eventually, you can even go all the way down like this, but you may not be able to start out that way. Even if you can just start here, that's okay. And then gradually work yourself down to here. And each time holding 5 or 10 seconds, you can do 10 or 15 reps of those. Okay, so for the next one, you're going to grab a towel. And so like a hand towel, And what you're going to do, so now let's say my left arm is my affected one. So usually it's difficult with frozen shoulder to reach behind your back. So we're going to work on that a little bit. So take this towel, hold it in the opposite hand, and just kind of bring that towel behind your back like this. And then you're going to grab the towel. And if you can't reach all the way back, that's okay. Just grab it where you can. So say, even if you're out here, that's okay. You're going to use this top hand to pull. And if you can get all the way up, great. If you can get even a little bit, great. You're just going to pull and kind of stretch there. Just hold about 5 seconds, and then kind of relax. 5 seconds and relax. And just wherever you can go. So even if you don't feel like you're moving that far, that's okay. Even if you can kind of move across your back, maybe, that works as well. And then just gradually increase how high you can lift that. You're really using this top hand to pull the bottom hand just into a stretch. And again, hold wherever you can go, hold 5 seconds and relax. And then repeat that 10 or 15 times. So all of those exercises are a great place to start if you're experiencing any frozen shoulder, even if it just started, a few weeks ago, or it's been going on for a year. You can do these exercises. It will gradually start improving your mobility and your strength and decreasing your pain and kind of getting you on the road to recovery. But just be patient and be consistent with these exercises. The frozen shoulder will eventually get better, especially if you're working on it.